In the battle against Parkinson's, two medications stand tall: Sinemet and Azilect. Both aim to control the symptoms of this debilitating neurological disorder, but which one reigns supreme? This video dives deep into the Sinemet versus Azilect debate, offering a comprehensive analysis of their effectiveness, side effects, and overall suitability. For those seeking relief from Parkinson's symptoms such as tremors, stiffness, and impaired coordination, the choice between Sinemet and Azilect can be overwhelming. Sinemet, a combination of levodopa and carbidopa, has long been considered the gold standard for treatment. On the other hand, Azilect, a selective MAO-B inhibitor, has gained popularity in recent years for its ability to delay the progression of the disease. We'll explore the differences between these two medications, examining their mechanism of action, dosage guidelines, and potential interactions with other drugs. Additionally, we'll touch upon patient experiences and expert opinions to provide a holistic understanding of the Sinemet versus Azilect dilemma. If you or a loved one are grappling with the decision of which medication to choose, join us as we unravel the intricacies of Sinemet and Azilect, shedding light on the path to optimal symptom management and improved quality of life. Understanding Sinemet and Azilect. Sinemet and Azilect are two commonly prescribed medications for Parkinson's disease. While both medications aim to alleviate symptoms, they differ in their mechanism of action and overall approach to treatment. Mechanism of action: how do Sinemet and Azilect work? Sinemet contains two active ingredients: levodopa and carbidopa. Levodopa is a precursor to dopamine, a neurotransmitter that plays a crucial role in movement control. By providing the brain with levodopa, Sinemet helps replenish dopamine levels and alleviate Parkinson's symptoms. Carbidopa, on the other hand, enhances the effectiveness of levodopa by preventing its breakdown before it reaches the brain. Azilect, on the other hand, is a selective MAO-B, monoamine oxidase B, inhibitor. MAO-B is an enzyme that breaks down dopamine in the brain. By inhibiting this enzyme, Azilect helps increase dopamine levels, thereby improving motor function and reducing symptoms. Efficacy: comparing the effectiveness of Sinemet and Azilect. The effectiveness of Sinemet and Azilect in managing Parkinson's symptoms has been extensively studied. Sinemet is known for providing rapid relief, with many patients experiencing a significant reduction in tremors and stiffness shortly after starting the medication. However, long-term use of Sinemet may lead to a phenomenon known as wearing off, where the medication's effects diminish over time, requiring higher doses or additional medications. Azilect, on the other hand, is primarily used as an adjunct therapy to levodopa. Studies have shown that Azilect can delay the progression of Parkinson's disease and provide symptomatic relief when used in combination with levodopa. However, it may take several weeks for Azilect's effects to become noticeable, and its efficacy may vary from person to person. Side effects: common side effects of Sinemet and Azilect. Like any medication, Sinemet and Azilect can cause side effects. Common side effects of Sinemet include nausea, dizziness, and headache. Some patients may also experience dyskinesia, which is characterized by involuntary movements. These side effects can often be managed by adjusting the dosage or adding additional medications. Azilect, on the other hand, is generally well tolerated, with fewer side effects compared to Sinemet. However, some patients may experience headache, joint pain, or flu-like symptoms. It is important to discuss any side effects with your healthcare provider to ensure proper management. Dosage and administration: how to take Sinemet and Azilect. The dosage and administration of Sinemet and Azilect can vary depending on individual needs and response to the medication. It is essential to follow the prescribed instructions and consult with your healthcare provider for personalized guidance. Sinemet is available in different strengths, and the dosage is typically tailored to the patient's specific requirements. It is usually taken multiple times a day, with the timing and frequency determined by the healthcare provider. It is important to take Sinemet with or without food as directed, as food can affect the medication's absorption and effectiveness. Azilect, on the other hand, is typically taken once daily. It can be taken with or without food, as food does not significantly affect its absorption. It is crucial to follow the dosage instructions provided by your healthcare provider and avoid any adjustments without their guidance. Cost comparison: pricing differences between Sinemet and Azilect. The cost of medications can be a significant factor in the decision-making process. Sinemet is available in both brand name and generic forms, with the generic version generally being more affordable. However, it is important to note that the price can vary depending on the dosage and quantity prescribed. Azilect, being a newer medication, is currently available only as a brand name product. As such, it may be more expensive compared to the generic versions of Sinemet. It is advisable to check with your healthcare provider or pharmacist for information on pricing and potential insurance coverage to make an informed decision. Patient experiences real-life stories of patients using Sinemet and Azilect. To gain a deeper understanding of the experiences of patients using Sinemet and Azilect, let's take a closer look at some real-life stories. John's story. John, a 60-year-old diagnosed with Parkinson's 5 years ago, initially started with Sinemet. He experienced significant relief from his symptoms, particularly in terms of reduced tremors and improved mobility. However, over time, he noticed the wearing-off effect and required higher doses. Upon adding Azilect to his regimen, he noticed a further improvement in his symptoms and a delay in disease progression. Sarah's story. Sarah, a 45-year-old recently diagnosed with Parkinson's, was prescribed Azilect as a monotherapy. While she did not experience immediate relief, she noticed gradual improvement in her symptoms over several weeks. Azilect helped stabilize her motor function and provided a steady level of symptom control. These stories highlight the individual nature of Parkinson's treatment and the importance of finding the right combination of medications for optimal symptom management. Choosing between Sinemet and Azilect. Factors to consider. When it comes to choosing between Sinemet and Azilect, several factors should be taken into consideration. Symptom severity. The severity of Parkinson's symptoms can influence the choice of medication. Sinemet, with its rapid relief, may be more suitable for individuals with more pronounced symptoms, while Azilect can be considered for those with milder symptoms or as an adjunct therapy. Disease progression. Azilect's ability to delay disease progression may be a determining factor for individuals in the early stages of Parkinson's disease, where preserving long-term function is a priority. Side effects and tolerability. The individual's tolerance to medication and any specific side effects experienced should be carefully evaluated. Some individuals may be more susceptible to certain side effects, necessitating alternative treatment options. Cost and insurance coverage. Affordability and insurance coverage should also be taken into consideration, as they can impact long-term medication adherence. Ultimately, the choice between Sinemet and Azilect should be made in consultation with a healthcare provider, taking into account individual needs and goals. Conclusion and final thoughts. In the battle for control over Parkinson's symptoms, Sinemet and Azilect stand as formidable contenders. Sinemet's long-standing reputation as the gold standard for treatment is balanced by Azilect's ability to delay disease progression. Understanding the mechanism of action, efficacy, side effects, dosage guidelines, and patient experiences can help guide the decision-making process. It is important to remember that Parkinson's disease is a complex condition, and the treatment approach should be tailored to each individual's unique needs. Regular communication and collaboration with healthcare providers are crucial for optimal symptom management and improved quality of life. Whether you choose Sinemet or Azilect, the goal remains the same: finding a treatment regimen that allows you or your loved one to regain control and live life to the fullest despite the challenges posed by Parkinson's disease.